Hello and welcome to the St George's University of London webinar on healthcare courses and careers. My name is Jenny and I am part of the student recruitment team here at St George's. And with me today is Fiona. Fiona, would you like to welcome our guests?
Hi everybody, yeah, I'm Fiona and you'll see me again at the end of the session. So do pop in your questions into the question pane and we'll try and answer some at the end of the session. You might see a little icon on your screen that has a hand, so it's like a raise hand option, but we'd ask you not to raise your hands throughout the session because we're going to be asking you to do that when we ask you a specific question later on. But I'll see you later on.
Thanks, Fiona. Great, yes, so keep your questions coming in. So let's get started with the presentation. So today we're going to be talking a little bit about St George's University of London and some of our undergraduate healthcare courses and also the application and interview process. And when speaking about St George's, I'm going to cover looking at St George's in the past till today and a little bit about our student life. So when we're talking about, when thinking about St George's, I like to first go back and look at where we began. And St George's is unique in that we're the only UK university that shares our campus, our site with a hospital, which is St George's Hospital. And we've had this close relationship for over 250 years. And St George's, the hospital first opened in 1733 in Hyde Park Corner in central London. And although we began as a medical school with our first graduates graduating in 1752, since then we have broadened the courses that we offer to now include a range of healthcare courses and postgraduate courses. And I want to talk a little bit about our pioneering past, so our notable alumni. And you can see here just a selection. We've got John Hunter, who's often known as the father of modern surgery, and he studied and then worked at St George's Hospital, and many of the specimens that he collected can be seen in the Hunterian Museum in central London. Edward Jenner is a pioneer in smallpox vaccinations, which and smallpox has now been eradicated, and this was one of the world's first vaccinations. And Henry Gray, he was also a surgeon, a renowned surgeon, and he's mainly known for the anatomy book that he wrote called Gray's Anatomy, not to be confused with the television program. And Gray's Anatomy, the books are still in production today and are a really useful resource for anyone studying anatomy. In the 1980s, St George's, the hospital and the university moved to our current location in Tooting, southwest London. And at St George's University, you are surrounded by healthcare. And some of you might already be familiar with the hospital, St George's Hospital, in that Channel 4 provide the program 24 Hours in A&E, which is recorded at St George's. And you can also see here the rooftop of St George's Hospital that supports the air ambulance, and this for patients that require critical care. And this is something that we are, staff and students are familiar with, the air ambulance landing on our roof. The university is a 10-minute walk from Tooting Broadway Station, which is the Northern Line, and students can get into central London in approximately 25 minutes. In Tooting, we are surrounded by retail shops, bars and restaurants and markets. Horton Halls, you can see here, this is our student accommodation, and that is about a 15-minute walk or a quick bus journey to the university. And we hold accommodation for students who have accepted a place onto our course, who have placed themselves as firm, and usually first-year students. And the accommodation itself, each room has its own ensuite, bathroom facilities. You have shared laundry and kitchen facilities. There's also a general communal area, and you can see our students relaxing there at the moment in this photograph. The accommodation has full internet access and has 24-hour security. But it's not just about studying. We also want our students to join societies and clubs. And we have over 100 clubs and societies at St. George's. You can see a few of them here. And on Wednesday afternoon, we don't have any lectures or classes so that students can enjoy their time and get involved with societies. We also have prayer rooms and counselling rooms available. We have career guidance available for our students and our alumni. We also have an on-site dissection room, as well as our pathology museum. And we also have specialised simulation facilities, which I'm going to talk about in a little while. So let's have a look at some of the courses that we provide at the university. So these are a list of our undergraduate courses, and we're going to be talking today about these courses in particular. If you're interested in medicine, we are doing a webinar for medicine, the undergraduate course, and we touch a little bit on the graduate medicine program and also the biomedical science program. If the healthcare course that you're interested in is not covered here today, then you can visit the NHS Healthcare Careers website and learn more about over 350 different careers available within the NHS. If you're interested in midwifery or nursing, then you can visit Kingston University's website for their courses. For many of the healthcare careers, you now require a degree. However, some courses may provide in-service routes, so do check the professional bodies for your chosen career and contact the universities for further details. I won't be providing entry requirements for healthcare courses that we'll be discussing today. However, the information can be found on our website, and if you have any particular questions, please email our study@ email account. You can see the details there, and our team will be happy to answer your questions. So many of you might already be familiar with our first course, having seen ambulances whizzing by, but have you ever stopped to think what these paramedics are doing? So paramedics are what we call first responders, and they deal with a range of situations from life-threatening conditions such as cardiac arrest or multi-systems trauma, or they also deal with mental health and minor injuries. And paramedics provide emergency pre-hospital care. And as a paramedic, you need to respond to emergency calls. And you may need to provide immediate care to a patient in a range of situations, from the patient's home, place of work, or the side of the road. And there's so many places where emergency assistance is required. Graduates can find work in a variety of environments, including traditional ambulance service, GP practices, hospital wards, theatres and A&Es, helicopter emergency services. Most paramedics are employed by the NHS, but some can also work in the private sector. And this is the type of job where you have a variety, where you won't be sitting behind a desk, and you'll need to work independently and be able to take charge of a situation, to problem solve and to communicate effectively with other people. At St. George's, 50% of the course is spent learning in the workplace, with the other half in academic study. And students spend time working with the London Ambulance Service, and other placements include hospital wards, A&E, maternity units, intensive care units, and other community-based placements. 96% of graduates are employed in roles relevant to their degree, and teaching occurs in a state-of-the-art paramedic simulation centre, where we've reconstructed home environments, ambulances specially modified for training. We have an interactive immersion room, and you can see that interactive immersion room here with our students that are surrounded by a fire. Now we can project in this immersion room fire, a side of the road, a field with snow, any number of situations. And this allows our students to feel immersed in the environment, but be safe and secure, and have their tutors and support staff by to help them as they're training. And students are taught by paramedics and other specialists in their area when they train in a paramedic course with St. George's. So a paramedic will get a patient safely to the hospital, where the clinical team will then take over. And one member of this team can be a diagnostic radiographer. And a diagnostic radiographer are trained to use a wide range of sophisticated equipment to assist them to diagnose and to treat a range of conditions. Diagnostic radiographers work within a multidisciplinary clinical team. The type of work that you may already be familiar with some of the tools that a diagnostic radiographer uses. So an X-ray, ultrasound, CT, MRI, and diagnostic radiographers use these tools to produce high quality images of the body. And you can see here a student preparing a patient for an X-ray and a tutor examining an X-ray of a hand. And they use their knowledge and experience to understand these images so that they can then diagnose and treat the patient. Diagnostic radiographers work as part of a medical team as they provide a treatment plan for the patient. The majority of diagnostic radiographers work within the NHS, and some work in research or teaching. Now, if you're excited by a job where you will use these diagnostic tools to create images of the human body, which you will then use to help you to treat a patient, and if you like to problem solve and you enjoy working as part of a team, then this might be the career for you. Our students spend 50% of their course time on placements within the NHS Trust as a student radiographer. 98% of graduates are employed or are continuing in their studies within 6 months of completing their course. At St. George's, we've invested almost £2 million to provide our radiography students with the highest quality simulations facilities, which you can see pictured here. And these facilities allow our students to practice while under the support and supervision of their teachers, who themselves are experienced radiographers, before they then start their placements. So you may have heard of a diagnostic radiographer, but have you heard of a therapeutic radiographer? Well, a therapeutic radiographer manages and treats people who are dealing with cancer. And perhaps you've heard of oncology, and this is the study of cancer. And the field of oncology has 3 major areas: medical, surgical, and radiation. And therapeutic radiographers treat cancer patients using radiation. Therapeutic radiographers are also sometimes known as radiotherapy radiographers. So therapeutic radiographers are also use sophisticated equipment. And here you can see some of our students viewing the linear accelerator image, using their 3D glasses to enhance the quality of the experience when training. And students get to practice using the linear accelerator in the VERT and treatment planning suite, VERT meaning virtual environment for radiotherapy training. And therapeutic radiographers plan and deliver treatments for patients, and they do this, and this is critical, that they accurately target the site of the disease and then provide the right amount of radiation. And there are 2 stages in this planning process. An X-ray or a scan is taken to determine the exact position for the treatment, and the treatment schedule is then prepared in consultation with a doctor. The majority of therapeutic radiographers work within the NHS. Some choose to work in research or teaching. And as a therapeutic radiographer, you'll have an opportunity to spend time with the patient as they progress through their treatments. Therapeutic radiographers spend a longer time with their patients than a diagnostic radiographer would. So this is a job where you'll need to have excellent interpersonal skills to support the patient and their family through the treatment process, and excellent problem-solving skills as you work as part of a team to deliver the best treatment plan for the patient. Our therapeutic radiography students have the opportunity to practice scenarios using our in-house simulation center, and this allows our students to practice in a safe environment and under the supervision of qualified radiographers. 100% of graduates are in employment within 6 months after completing a course such as this. Some of our patients are seen by our patient's been seen by a diagnostic radiographer and is now on their way to recovering. And as part of the recovery process, the patient may be seen by a physiotherapist. And a physiotherapist uses manual therapy as part of the rehabilitation process for a patient who has sustained an injury or is dealing with an illness or a disability. Physiotherapists may use manual therapy skills, exercise techniques, provide educational and information and advice to their patients, and you can see our students here practicing on each other and using some techniques. Physiotherapists need to have an in-depth understanding of how the human body works. Physiotherapists tend to work in a range of locations, including the NHS in, say, the intensive care or stroke units, health centres, sports clinics, clubs and gyms, private practice. And physiotherapists work with a range of patients, from babies to the elderly, so it's not just about those who are interested in sports. And as a physiotherapist, you can look to specialize in an area of physical therapy that is of interest to you. Now, you might enjoy this career as a physiotherapist if you're interested in anatomy and physiology, therapeutic exercise, health promotion, or if you're wanting to look to run your own clinic. 98% of students are employed or in doing further study within 6 months of graduating from our course. And students learn anatomy in our in-house dissection room, and they're also taught by physiotherapists. And at St. George's, we've established links with the local NHS and social care organisations to boost employment prospects for our students. So our patient is receiving treatment by a physiotherapist, and now they're on their way to recovering, but there appears to be a permanent injury. And this patient may now be seen by an occupational therapist. And occupational therapists help people to improve their ability to perform everyday tasks. And here you can see one of our students learning to cut an apple using a modified handle as a grip for the knife. Occupational therapists provide support after life-changing accidents. So this may include modifying the patient's home so that they can get in and out of, say, their bathroom, or changing the handles on their doors or cupboards so that they can then open the doors unaided. Occupational therapists help people dealing with mental health issues and support people coming to terms with disabilities caused by major trauma. So this is a career where you can be creative, you'll need to have a positive outlook and patience, and you will be helping to support patients to regain their independence and as much of their former function as possible, which can take time. Occupational therapists work within the NHS, such as in rehabilitation units, but this is a career that has much broader opportunities. So occupational therapists can work in social care, housing, education, prisons, employment services, voluntary organizations, private practice. 98% of our graduates are employed or continuing in postgraduate training. At St. George's, we've established links with the local NHS and social care organisations to boost employment for our students. And placements can be in a range of settings within the Greater London area, as well as opportunities to do international placements. And our students are also taught by occupational therapists. And our final course here is healthcare science. And perhaps this is a course that some of you might not be as familiar with as, say, some of the other courses we've just discussed. But our healthcare science course trains students to become physiologists who specialize in cardiac or sleep and respiratory conditions, where cardiac means heart and respiratory means lung, throat, and nose. At St. George's, we're the only university in London who offers a course as this. It provides training for both cardiac and respiratory specialties, which means that our first year students can experience placements and training in both areas and choose to specialize as a cardiac physiologist or as a sleep and respiratory physiologist. And healthcare science is one of the fastest moving areas within the NHS. As a cardiac physiologist, you will deal primarily with the diagnosis and treatment of heart disease. You will set up equipment, carry out procedures, record and analyze the results, Tests can include echocardiograms or ECGs, angiograms, or measuring blood pressure. As a sleep and respiratory physiologist, you will assess sleep disorders, treat patients with lung disease, deliver ventilation for patients on wards or at home, and assist in all aspects of lung function. This is just some of a few of the duties that a cardiac physiologist and a sleep and respiratory physiologist would perform. And you'll work as part of a multidisciplinary team and work within the NHS in hospitals in the UK or around the world. As a cardiac physiologist, so you'll work within the cardiology department or an outpatient clinic or wards and operating theatres. And a sleep and respiratory physiologist, you'll work within the sleep and respiratory department, chest unit, and sleep centres. And 50% of 50 weeks is spent on placements during the clinical training, and you can choose from a wide range of hospitals and NHS trusts. And you get a lot of patient contact in this course. There's a 100% employment rate post-graduation, and we provide small cohorts at St. George's, which means our students can get individualised academic support. So now we're going to look at the application and interview process. Excuse me one moment. There we go. So I'm going to be talking about the personal statement in some detail, work experience, and the interview. So what do we mean by the application process? Well, some of the steps that you need to take for the application process is, first of all, to do research. It's really important that you identify as much as you can about the course that you're interested in and the career that you want to be a part of. So I would advise to look at universities' websites, speak to their inquiries team. If there are virtual open days or any events or activities that can give you some more insight into the course, then take advantage of this. Also have a look at the professional bodies for the courses that you want to apply to. For healthcare, you'll need to register with a professional body. So check to see that the course you want to apply for either allows registration, or if you have to do additional studies, find out what you need to do. At St. George's, our courses, our undergraduate courses that we discussed, do lead to registration. Then you need to, when you're applying through UCAS, you need to make sure that you know the deadline for the course, and you also need to know the institution code and the course code. And then lastly, it's important that you know the entry requirements for the course, and this also includes the GCSE level grades and also the academic and non-academic requirements. So do check the websites and be sure that you know all of this before you apply. Check to see what work experience is needed. For many healthcare courses, you'll need to do some work experience, and we're going to talk about that in a moment. And also there's an academic reference that's required. So for those of you who are at school, your schools will help you with this. But if you're no longer in education, do try and reach out to the course provider where you completed your highest qualifications and see if they can get you an academic reference. So one of the things that you require when you're making an application through UCAS is a personal statement. And what exactly do we mean by a personal statement? Well, this is an opportunity for you to show your passion to us, your passion about the course and the career that you want to join. And we want to see what insight and understanding you have about this course. So, for example, we know today that diagnostic radiographers, for example, use sophisticated instruments and tools such as MRIs and CT scans. So you'd want to be putting that into your personal statement if you're interested in radiotherapy, in diagnostic radiography. So, and it's also a really great place to put work experience to show your insight into the career as well. What we're looking for is to see that you are the right candidate. So we want to see all your strengths, and we also want to see it we want you to write your personal statement in your own words. So when we're talking about work experience, what exactly is the university or universities looking for? If you're applying for a clinical course, healthcare courses, say you're applying for medicine, for example, they'll obviously want a clinical experience working in a hospital or in a clinic, and I can appreciate that is difficult with social distancing at the moment. But then with healthcare courses, we're often looking for a broader non-clinical experience where you can demonstrate experience of helping others. And here we've got just a few examples of the type of work experience that we would be looking for you to have some experience of. And so you can see here the maybe you've got some work experience working in the care environment, so maybe working in a nursing home or a hospice, or perhaps you've been working in the community, maybe helping the homeless, or possibly you've done some teaching, and or you've maybe supporting a member of your family who has an illness, and that's really great experience. Perhaps you do some sporting activity, maybe you do some coaching, and or maybe you have a part-time job. And work experience can be both paid and unpaid. And when you're doing work experience, what we want you to do is to get the most out of it, is for you to reflect on what you've experienced. And reflecting, some of the tools that we use when reflecting it, I've listed here, and these 3 questions are what we'd be wanting you to ask yourself. And I think it's really important to keep a journal when you're doing work experience. So if you've done some work experience, maybe go back and reflect on what you've done. And what we're meaning here is by what, we're talking about what experience, what work experience have you done? The so what is, so what have you now, so what now have you gained from this work experience? And now what is, now what do you know about yourself that you didn't know before? So we'll now have a look at linking the work experience, to the interview process. So when you're at an interview, you'll be asked a series of questions, and work experience is an opportunity for you to demonstrate to the assessor an insight into the career that you want to join. It's not about just listing your work experience. What we want you to do is draw out from your experiences, what you've learned about the environment and what you've learned about yourself, and then link that to the question that you're being asked. So what I'm going to do now is we're going to do a little thing where you can put your hands up, so you can raise your hand. So for those of you, I've got a question here that said, do you think you have some relevant work experience? So for those of you who think you have work experience, if you can raise your hands. And for those of you who are not sure or you don't think you have, then you can, if you don't raise your hand, and then hopefully we can then see how many of you actually have some work experience. So bear with me while I try and see. Okay, I'll just give some time for you. I see we are getting some raised hands. That's great. So having now looked at some of the work experience that we are looking for from you, do you think you have some relevant work experience? I'll just give you a little bit longer for those of you who want to raise your hands. I'll just give you a little bit longer. We do have a lot of you here, so and we're getting quite a few people raising hands. That's great. And remember, work experience can be a whole range of things, paid and unpaid. So if there's anything that you think that you might have, and it's not a problem if you haven't, we're just trying to see from our audience how many have possibly got some work experience already. Okay. Oh, we're still going up. Okay. Still quite a few of you have raised your hands. So I think we'll leave it there. I'm sorry if you're still raising your hands. I really appreciate the you're getting involved. It looks as if about 70 of you, or about 58% of you, feel that you've got some relevant work experience. So that means the rest of you either you don't or you're unsure. So what I'd say is, for those of you who have got relevant work experience, take the opportunity, if you haven't already, to go back and reflect on what you've learnt. It's going to be really useful for you at the interview stage and preparing for your application. And for those of you who are unsure or haven't got work experience, we have a webinar specifically for work experience, and you can register yourself for that. And I'll be giving you some details at the end of this presentation. And we've also got our Explore St. George's webpage, and this is relevant for everyone who's either got work experience or hasn't. And on the Explore St. George's webpage, we've listed and provided links to a range of work experience that you can look to do online, and hopefully give you some more insight into work in healthcare. So we'll now move on to, and thank you all very much for that. I'll now talk to you a little bit about the interview process. So at St. George's, for the courses that we've been discussing, we do require interviews for those courses. The only undergraduate courses we don't interview for is the biomedical science and the clinical pharmacology. For all of our other undergraduate courses, we do require an interview, and we use what we call a multi-mini interview, or an MMI. And you can see the picture here of our MMI room. And it's a series of stations. So you will go into, you can see the gentleman is standing outside of one of the stations. So he'll go into that station. He'll then be asked a question by the assessor, or maybe two questions. He'll then have some time to talk and answer the question. He'll then come out of the station and then rotate around the room, and each time getting a different question. Then when you've completed the entire rotation and answered all the questions, those questions will be marked, and there'll be an overall score provided. And if you're successful, then you'll achieve a place on the course. Now, some institutions might do MMIs, and some might do a panel interview, and you can see a picture of that here. And that's where you've got all of your interviewers in front of you. And some institutions might do a group interview. So do check with the universities for the courses that you're interested in, and make sure that you're familiar with the interview process. At St. George's, we've got information about our MMIs on our website, so you can take a look at those when you want. And next, I want to talk about some of the our questions that we ask in our MMIs are very much based around what we call key competencies. And I've got listed here some of the key competencies, and some of these might be familiar to you, or certainly might make sense as to why we'd be looking for these type of competencies in students and in healthcare practitioners. So communication and teamwork, well, if you're part of a multidisciplinary team, you're going to have to work with a range of people, and you're going to have to work with patients and be able to communicate with patients from all different ages and backgrounds. And our empathy is about understanding the other person's point of view. And you possibly can see how important that is if you're dealing with patient care, and understanding how the patient is feeling is really core to providing the best service possible. And the other one that is here is effective learning style. An effective learning style is about how do you manage your own learning. Now, for example, I know that I'm a visual learner, so I really like visual aids, and I also learn best when I'm practicing and physically doing a task. So I know that how to make the most of my learning. So that's really important to be aware of. Now, the other two that you might not be aware of is insight and integrity, where insight is where you're able to understand the situation and determine the best course of action to resolve that situation. And integrity is having principles or values. And we're going to consider in a moment the NHS values. The other one I want to talk about is initiative and resilience. Now, initiative is about taking action to help resolve a situation, and resilience is about recovering quickly when something goes wrong and learning from that experience. And so, for example, when taking action to resolve a situation is really critical if you're a paramedic, as you are racing against time to assist a patient, and sometimes things might go wrong and you'll need to reassess the situation and think of solutions. Often healthcare workers can work long hours, do shift work, and they deal with a range of patients who are vulnerable and in need of care. And this can be emotionally and physically draining and tiring. So having the capacity to recover from stress is a really valuable skill to have. And in the interview process, we're looking for you to be able to demonstrate these competencies, firstly to understand them, and then to demonstrate your understanding with examples from your work experience. Now, you might want to discuss these key competencies with your teachers or your classmates or friends, and look at how key competencies would work within the NHS and a career in healthcare. And then next, we're going to look finally at the NHS values. And what I thought I would do here is I've taken out the values so that you can then think about what they might be. Now, you don't need to raise your hands or put your answers in the Q&A section. But what I'd like you to do is from that list that I've provided there, can you determine, do you know what the NHS values are? Possibly you've already been on the NHS website if you're interested in healthcare courses, but if you haven't, maybe you can kind of guess what they might be. So I'll let you know what they are. So these are the 6 C's, as we call them, the 6 C's of healthcare for the NHS, and they're the NHS values. So, and possibly you can understand how these values are really important to encompass if you're wanting to study and to work in the NHS. And so finally, let's look at review what we've learned. We know that St George's University of London is the UK's specialist healthcare university, and that we've been improving public's health for over 250 years. And we're the only UK university that shares its campus with a hospital. And at St George's, you really are surrounded by healthcare. We've also looked at a range of healthcare courses, from paramedics who provide immediate care to diagnostic radiographers who use technical equipment to help diagnose injury. And at St George's, you're taught the skills that will support you throughout your career. And then finally, we were looking at the application and interview process, where we looked at remembering to do your research, to look at the entry requirements for the course and to apply on time, using your personal statement to demonstrate your understanding of the course and the career, and of course using your own words. We also learned that there's a wide range of work experiences that universities are looking for, and that to get the most out of your work experience, it's really important to reflect on it and then use this reflection and use what you've learned through this reflection when you're answering your interview questions. And one of the best ways to do this is obviously keep a journal when you're doing work experience. Now that's the end of the presentation. And I just want to give you some little bit of information before we go and try and answer some of your questions. So here you'll see our contact email. So if we're not able to get through all the questions today, and we'll certainly try and get through any of the questions that come in, we will send you an update. So anyone who's asked a question during this webinar, we will get back to you. But if later on you've got questions, you can contact us at webinars at St George's, or you can contact us at the study@ email address. You could also find us on Instagram, Twitter, and Facebook. And we'll be sending you a summary sheet at the end of this webinar today. I just want to reiterate, we've got the Explore St George's page where you can get a lot of really valuable resources there. So do take time to go and have a look at that. We've got the work experience webinar taking place on the 10th of June. So do register for that. And we've got a medicine webinar on the 18th of June. So now hopefully we've got some time now. So Fiona, do we have any questions?
Hiya, yes, we do. So first of all, Max asks, he says he knows he's interested in healthcare. He
Great.
wants to help people and he's interested in science, but he doesn't know which course to choose and how he should go about that.
Oh, fantastic. Thank you, Max. It's a great question. Obviously the first thing I would say is to do your research, which I'm sure you've already started and done. And you firstly need to think about how much patient contact do you want? And do you want patient contact? Because that will really help you to define the type of course that you want to undertake. So if you want a lot of patient contact, then you'll want to go for more clinical courses. And if you want to go down more the science route and supporting other healthcare professionals or research, then maybe look at a more academic type of course. I'd also suggest to go to the NHS website for careers and have a look at the range of courses. I know that's a lot to think about, but maybe that will help you to think about a course that interests you, because obviously you really want to be passionate about what you're doing. Yes, so do you have any suggestions, Fiona?
No, I think that was great, Jenny. We did have another few questions. So Angela says she's got work
Great.
experience with St. John Ambulance, and she's asking, is that relevant for other healthcare courses besides paramedic science?
Oh, absolutely. Yeah, I mean, it's great hands-on experience, and if you're interested in medicine, obviously that's a very many students have that kind of experience if they're planning to do a medical course, but you've also got a lot of transferable skills. So you don't necessarily have to go down the medical route. You can look at any healthcare course and see about anything to do with teamwork. There's a lot of transferable skills there. So no, I think that's really very useful work experience. Is there anything that you want to add, Fiona?
No, I think that was great, Jenny. I'll just move on to
Great,
the other couple of questions we've had.
great, thank
So
you.
Sahir asks, he says, how should I choose between diagnostic and therapeutic radiography?
Ah, that's great. Well, I mean, first of all, it's they're obviously treating very different patients. I think one of the things that might be key is how much patient contact do you want and what type of patient contact do you want. So if you're interested in spending longer with the patient and you're interested in, especially if you're interested in helping them manage cancer treatment, so therapeutic radiography would certainly be the course to take. But if you're interested in using a range of tools, if you want to work with a range of patients, but for a shorter period of time, and you will look to diagnose and treat patients, then maybe the diagnostic radiography program is something you might want to consider. But certainly do have a look at our website or any other websites for institutions that have these programs, and contact the institutions, check to see if there's any student chat rooms, such as the student rooms have chat rooms, and talk to students who are on the course, because they're a really valuable resource for trying to work out which is the right career for you, because they're doing the course. Anything that you might want to add, Fiona?
No, I think that's great. One last question from Wajiha. She's asking, does paramedic science have shift work?
Yes, it does. Being a paramedic, yes, it will have shift work. Um, because obviously you've got to attend to patients at any time of the day, and you would work in, and it obviously depends where you're working, but certainly there would be an element of shift work in it, as there is for many healthcare courses.
Yeah,
Anything
and
you'd like to add?
I was just going to say, so when you study the paramedic science course, obviously you do placements.
Mm,
And actually, for all healthcare courses, you do placements during your course. For paramedic science, at St George's, where we work with the London Ambulance Service, so students actually and they do shift work just as if they were basically paramedics on the actual course. So you really get kind of immersed, and you're essentially doing pretty much the job of a paramedic when you're actually doing the course. So yeah, you do shift work as
yeah,
part of the course even before you're fully qualified and working as a paramedic.
yeah. Thank you, Fiona. That's great. Do we have time for any further questions?
I'm afraid we don't, but as Jenny said, we
Ah,
will be getting back to you with all your questions after, and we will be sending you resources and a summary sheet of the webinar as well. So
yeah.
thanks. Bye from me.
Thanks so much. Thanks, Fiona. And thank you to everyone. I hope you found this webinar to be helpful. And thank you for spending time with us today. And good luck with your research and finding a career for you. And thank you again for spending time with us. Take care. Bye-bye.